Thank you so much for sparing your time. I know how busy you guys must be at the moment. I sort of wanted just to quickly touch base with you, just to hear how things are going, how you're all coping, what it's like at the moment. Maybe just a quick update from all of you about your relative experiences in your departments as to what you're seeing and how it's a bit different than the first lockdown.
So this is worse than the first wave. I think that's probably the first thing we want to say. In terms of numbers, I think we currently have over 200 inpatients with coronavirus in our hospital, which is quite a small hospital in East London. I guess things started to become very evident to us that things were heading in the wrong direction actually a couple of weeks before Christmas. And then the week before Christmas, that became increasingly evident. And things probably hit a major crisis point really around the 4-day Christmas weekend.
That's a very good synopsis, Carla. Thank you. And it kind of it echoes many of the comments and evidence that I've heard of in the last few weeks. And it has clearly been climbing at a quite staggering rate across the country. And I think in the first wave, it was quite a bit more patchy in terms of which areas got hit hardest. But it sounds like most of the country is getting a really hard time at the moment. And Alicia, is that your views of what's going on at the moment?
In terms of nursing having to learn new skills and been working on a surgical ward and now having to be transferred to a medical ward, nurses and outpatients, we had to do a lot of redeployment of staff, but they have just come to the forefront and they have learned the new skills and they're supporting each other. I think one thing that we need at the moment, because of staff being so stretched, is everyone coming together. And I think Homerton, we're achieving that. We are a small hospital, but it's a family-based hospital.
Catherine, just turning to you, how is morale in general? I mean, everyone here has been very chipper and kind of being very upfront and upbeat about things, but are you picking up that sort of thing across the whole hospital?
I have to say, I think this week for us, starting vaccinating has probably had one of the single most significant impacts on people feeling that there is something, a future out of this, and the queues out the door downstairs here where they've been vaccinating have been really kind of hopeful for people.
And in terms of your mental health support, Nazia, what sort of things have you done recently to kind of combat some of the stresses and difficulties that everyone's been facing?
There were things like the wobble room that was put in, which is a place where you can just get away from just being on the wards. They had a pet therapy, which again, dogs are very popular and therapists made sure that they were around. We've had talking therapies offer, so not just the big NHS one, but there's a talking Homerton one that we've definitely availed. And we also are very lucky in therapies to have some psychologists that work within our team. So just kind of getting some ideas of how to debrief, how to contain space, and create that sense of it's okay not to be okay.
Debbie, are you, in terms of your family sort of situation, are you, or any of you particularly, living away from family at the moment?
Fortunately, my daughters don't live at home, but they live away and then they have children. But one lives quite far and one lives quite near, but because of where I'm working and they've got their shielding and they've got babies, one's now told me she's pregnant again. I can't, thank you. I just can't feel comfortable.
But if I may just say, on behalf of everyone else, maybe that bold, but a huge thank you to all of you for all the hard work, the sleepless nights, the lack of sleep, the stress, the anxiety, the exhaustion, and everything that you're doing. We are so grateful. You're all in my thoughts, and Catherine and I and all the children talk about all of you guys every day. So we're making sure the children understand the sacrifices that all of you are making. So thank you so much, and thank you for your time today. I know how busy you are, but I just wanted to pop in and just say, good luck, and we're all thinking of you.